Okay, it says it's recording.
Terrific. And don't worry, you won't be responsible for it.
Okay.
I am going to start it, though, because it's 4 o'clock. I think people will continue to join us because we have a lot of people signed up today, but I want to give us a full amount of time for question and answer. So are you ready, Chris? Are you okay with me starting?
Yeah, sure. I'm ready. I'm also, I think, you know, if you want to wait a minute or two, I think we'll have enough time for questions and answers still.
Okay.
It's up to you. I'm fine whenever you are. Go for it.
We've got about 20 folks on, and it looks like I think we'll get quite a few more in the next minute or so. So maybe I'll just wait 1 more minute.
Sure.
I can always edit this off. All right. Good afternoon, everybody, and thank you for joining us for the August Choosing Wisely Learning Network webinar. Before we begin, let me cover a few logistics. This meeting is being recorded. We'll share it on Workplace when we're done. If you're not a member of Workplace, you are welcome to email me, krand@abim.org, and I'll send you a recording. While our presenter is speaking, we'll have the lines muted to reduce unnecessary noise, but we will unmute at the end of the presentation, or you can also unmute yourself by clicking the red microphone next to your name. And please feel free to enter questions into the chat box throughout the presentation. We'll make sure to answer all of them at the end. Through your responses to the Choosing Wisely Learning Network Needs Assessment, you've told us that you'd like to hear more about what's happening in medical education and high-value care, so we're excited to share our first webinar on the topic. And I'll turn it over to our physician consultant, Dr. Lisa Letourneau, to introduce our speaker.
Great, thanks, Kelly, and thanks everybody for joining today. We're really thrilled today to have Dr. Chris Moriates, who's the Assistant Dean for Healthcare Value at the Department of Medical Education at Dell Medical School, a very innovative new medical school in Austin, Texas. In that role, he's responsible for creating an innovative curriculum related to value-based healthcare and building value improvement programs that engage clinicians in these issues of creating and delivering high-value care. Chris is the executive director also of Cost of Care, a global nonprofit that seeks to bring together clinician insights about driving better care at lower costs. He created and leads the Choosing Wisely STARS program, which he's going to tell us more about, a program that initiated out of Canada, so he's leading this effort in the United States. He received his medical degree from the University of California at San Diego School of Medicine and completed his residency in internal medicine at Ucsf. So with that, I will turn it over to you, Chris. We are just very excited to have you here telling us about the program.
Yeah, thank you, Lisa, and thank you, everybody, for joining us. I look forward to sharing about our STARS program and also some of our plans and how we hope to grow it. So as mentioned, I am here at Dell Medical School in Austin, Texas, where it is currently like 100 and something degrees outside, by the way. But we are a new medical school. We have just started our 4th class, so we finally have a full house. So we'll be graduating our first class this summer. And my first day here was the first day the school had opened. And we've really focused on creating a health system science and value-based healthcare curriculum here at Dell Med. But one of my charges was to make sure that it reached outside of Austin. And this is one of my, I think, proudest examples of doing that, working with a large team of folks and collaborators to accomplish that. So as way of quick background, although many of you may on this call hopefully already kind of take this for granted, but just to make sure we're on the same page, there's been a lot of evidence. I capture 4, articles here in the references, but the environments in which medical trainees learn have lifelong effects on their medical practices. And this has been shown, I think, quite convincingly when it comes to the environment as it relates to quality and safety, and the outcomes that residents achieve after their training when they graduate, no matter where they go. As well as their intensity of care and their kind of practices as it relates to overuse and cost. So those who work and train in high intensity environments leave those environments, go elsewhere, but continue to practice in similar manners. And so trying to change behaviors, as we all know, is really challenging. It's the work that we all do. It's very important. I mean, and that's what Choosing Wisely is trying to do. But if we are to take the long game on this, and say when we really are going to make a difference, we need to start upstream. Because if we can change the attitudes and behaviors of folks upstream, the ripple effects from that will be tremendous. Eventually we'll reach all corners of our healthcare system. So when you think about medical students, they're undifferentiated at this point. If you change their attitudes and behaviors, they're going to go on to many different types of careers in many different fields within medicine and healthcare. And in many different parts of our country. So I'm a medical educator. I obviously believe in that mission and that goal, but it's something that I think really underlies what we're trying to do here, which is to say, let's say what we should be doing today, but let's also take the long game here and really teach about what we should be doing in the future. And I think that will have a sustainable effect. Now, to add to this, I think there's obviously a lot of evidence that medical training programs lack formal and informal curricula around training health professionals about value. And there's been tons of calls for that from our leaders in medical education, from health policy, and so on. So this is where we come in. Our colleagues Brian Wong and Karen Bourne in Canada actually had received funding from the ABM Foundation early on to start a program that they kind of came up with their students there that they called STARS, Students and Trainees Advocating for Resource Stewardship. They had some summer intern students. They sort of designed this whole program and co-created it with them. And the way they did it was they said, we're going to invite 2 students from each of the 17 medical schools in Canada. So there's only 17 med schools in all of Canada. And we will invite 2 of these students to come. We'll reach out directly to their dean and get them to support this. They'll come to Toronto at that time. We'll teach them about choosing wisely. We'll teach them about leadership and advocacy. And then we will have them go back to their schools and see what's and design programs within their schools to advance this program. So I'm getting a message that my slides are not advancing. How about if I do this? Are you guys able to see my slides advancing? I guess I can't see messages anymore, so I have no idea.
This is Lisa. Now they are. Yes. Yep.
Can you see my slides advancing? Yes.
Yeah. And now we can. Yes.
Okay. All right. Great. So I actually, as part of Costa Care, our group of Costa Care leaders, there were a number of us that were on the steering committee. And at the end of the first year of the Canada program, Karen and Brian were sharing how these students had gone back to their schools in Canada, how they had started curricula, how they'd come up with their own Choosing Wisely list for medical students, and shared this with, and actually had published this, how they had met with their curricular deans, and it kind of had incredible progress over the first year. And sitting here in my office in Austin, I was like, well, this is exactly what we should be doing here as well. So I said, what do you think about us doing a STARS program in the U.S.? Really using this idea that medical students can lead from where they stand, from being first-year medical students, and they can actually change the curriculum and culture around them. So we teamed up with the ABM Foundation as well as with the Macy Foundation, Choosing Wisely Canada, and the nonprofit Costa Care that I now direct. along with Dell Medical School, and we launched the first Choosing Wisely STARS program in the U.S. Back in 2017. And we sought to recruit at first 20 medical schools, and we got funding to do that. We actually had an overwhelming response and ended up selecting 25 medical schools that first year and getting 2 medical students from each school. Now, one of the lessons we had learned from Canada was some of the students went back to their medical schools and had tons of support, were able to do things, and others went back and really just, they were the only ones there. They really couldn't advance their projects. They had no idea how to go about it. So we, when we started STARS, actually recruited the faculty mentors at each of these schools. That was our first step. So we had faculty mentors who essentially recruited or submitted their own school to be a part of the program, so that we knew when we recruited the students, we said, you have a champion at your school already. This is the person who's going to work with you directly and coach you. We also that first year got a dean level, so either the dean or the curricular dean, or at some schools it was like a chair of quality and safety, but you know, like a C-suite level person who signed on and said, yes, we will support this program. And we were able to, so we had our first program, and I'll show you about what that looked like, but we've since had a second iteration where we grew to 40 medical schools. We actually had collected more than 50 applications from schools, but had funding to cover 40, and had 80 medical students here come join us in Austin this past January for the second Choosing Wisely STARS program. So what we do is we have each school select 2 first-year students, and we really leave it up to the school on how they select those students. So some schools put in place really, robust interviews and applications, and they, UCSF created a rubric that they scored essays on. And other schools, I think, just selected from either a track, like they already had a health system science track, or simply sent out a call for volunteers. And frankly, I don't know that any system worked any better than the other. As long as people were volunteering and wanting to come here, it seemed to be that we got really interested, engaged medical students. They came to Austin for a one-day summit where we did a number of things. We had Daniel Wilson from the ABM Foundation there introduce Choosing Wisely to them and kind of teach them about the history and the concepts about that. We had Ari Hoffman from UCSF really lay out the problem and talk about the problem in the U.S. around costs and overuse, and really tie this to the patient in front of them and get them to understand why this was not really a health policy issue, but a care delivery and medical education issue. And we showed them examples of what other students had done. So the first year we drew on the experience in Canada, and last year we were able to draw on the experience from our students, and we'll explain about that as well. And the students, I think, really seem to have a great time learning about these concepts, thinking about how they could apply it within their own medical schools and their own training environments. And we went through a number of kind of on-the-ground crowdsourcing activities with them to generate the best ideas, to work in small groups, start to think about what was feasible and what they could do. The other thing we did was really realize, I think, early on, and this Karen and Brian helped teach me, was to recognize that this is broader than just choosing wisely. That really what we're talking about here is leadership. And the program itself, the students from participating are getting a lot of lessons around leadership and advocacy. And so we really focus on that. I lead a session called Leading from Where You Stand, where we teach about how students can lead when they lack power. So how to use influence, how to advocate for things. And so that is a big part of the program. And we've actually, since we've evaluated these student leaders from across the world, as I'll talk about, there's been many programs. We had a summer student who did qualitative interviews with a bunch of these students across the world and found that really what they're gaining from participation in the program is real life experience in leadership and not just around the concept of choosing wisely and high value care in and of itself. The other thing we do with the students is we have them make a commitment. So at the end of the day, after they've learned all about choosing wisely, after they've learned examples about what others have done, they've had experiences to crowdsource and work in their small groups and really think about leadership. They then work with their co-star from their school and come up with a specific idea that they want to try to implement. They write it on a sticky note and they post it on our map. So this is the first year. We have these sticky notes all over the map about ideas that they had that they wanted to implement when they got home. And when they got home, we had shared what they had done with their faculty back at their local institutions. We had calls with their faculty to share kind of the program and what they were going to do. And we encouraged them strongly to meet with their faculty mentors, discuss what they plan to do, adapt at that point, right? So sometimes they go in and they say, here's what I plan to do. And then their faculty mentor says, oh, no, that's a non-starter here, or like we've already done that. And that's fine. But we start those conversations and get them working on things. So I have a number of kind of anecdotes that I'm going to share first, but then we'll put it in context with some overall outcomes of the program. And really, these are almost selected at random because every school had done so many different things. And so I'm just going to highlight a couple that we had pulled out. So at the University of Arizona, during the first year, we had 2 students there, and they had done, when they got back to their school, they first started a journal club using the ACP case-based learning modules, and they did this with the clerkship level students at their school. So they went in and they went through these cases together as a kind of journal club to talk through high-value care principles. They then used a survey to identify the student needs, so we're able to show that the students were, it says I'm still on the Canada slide. I don't know why my slides are not advancing. I can try again here.
Yeah, maybe Chris and Lisa, maybe if you just close out and start again. I don't know. As you know, it seems to be a quirky platform today, but.
Yeah, that's unfortunate. I'm sorry to hear that. I mean, I'm able to tell stories without the slides maybe, and then people can download the slides later. Sure. We can share them later. Yeah. I did just try something else, though. Do you see the University of Arizona slide now?
Sadly, no. It's still on that Choosing Wisely Canada Star. That's probably a system issue. So I'd say, yeah, just keep telling your story and we'll go from there.
Okay.
There we go. Now it is. Now it is. Yes, now it is University of Arizona. There we go. Yep.
Okay, and if I switch, can you see it says case-based learning example or no?
It seems to be a lag, so let me give it a second. Not yet.
Oh, this is interesting. Because it's advancing on my slides. Anyways, I apologize. It's advancing on my computer. I'll just kind of try to keep going through here, and maybe hopefully it'll work.
Sure. Thank you.
So these students also used a survey to identify their student needs. They integrated Choosing Wisely principles into their case-based learning course. And I've got an example of what that looked like. And they also met with their deans to discuss the importance of healthcare value education. So using their survey. So once again, it's really students leading from where they stand, right? And the deans, we have found, were much more likely actually to listen when the students came in and said, this is something that we think should be part of our education. And we've done a survey, we've spoken to the students, we went to this course in Austin, and we're part of a national learning collaborative. That tends to be a sympathetic message that we've found to be effective. So for instance, case-based learning example, you can imagine in these cases, it's inputting questions like, were there any laboratory tests used in this case that could have been avoided? Are there any downsides to prescribing antibiotics in this case? Would you order an MRI for this patient? Are there potential downsides to this imaging? And these are questions that might even seem obvious to us, but when you think about medical education, like, I don't think I was ever really asked this. When I did our cases, you essentially just picked all the tests that you would order, generally never losing points or anything for ordering too many. And there wasn't a lot of talk about thinking about the downsides. And so that's what they were able to introduce, which I think was really interesting and helpful. Another example, so Eastern Virginia Medical School, 2 students there. They completed a summer scholars internship program. As part of this, they actually applied locally and got a summer scholarship program. They created an integrated longitudinal high-value care curriculum at their school, working with their faculty leads there. And they actually presented these posters both locally and at national, at AAMC and IHI conferences, describing their curriculum and how they developed it. So these are first-year med students now presenting their curricular innovations at national meetings. And they also hosted a Choosing Wisely Day with an outside speaker. So they invited Amit Pawla from Johns Hopkins, who is part of our Choosing Wisely Stars faculty, to come, and he helped lead a special day at their school focused on choosing wisely, and it reached far beyond their school as the students and Amit and others tweeted it out and kind of spread the word. Dissemination, we also have students like our student at UW, Cassandra, who shared her experience both on the Costa Care blog and also on the ABIM Foundation blog, about her experience as a first-year medical student, giving a personal story, but then matching that to what she had done and learned through this program. And what we were able to do as well during that STARS event was we brought two of the students from the first year who had essentially applied to come present as part of a panel discussion. So we had two students and two faculty mentors, along with Brian Wong from Canada, who facilitated a panel and shared with the students what they had done. So for instance, in Chicago, the students actually put together working closely with their mentor, Vinny Aurora, a special community grand rounds, which was for patients, for the community, where they gave them resources that they had created and taught them about choosing wisely and taught them about 5 questions to ask your doctor, taught them about screening for cost burden and having discussions with their physicians about not being able to afford their medications, so they haven't been taking them. This was really actually very successful and very interesting, and so they came and inspired our students by describing that. We also had Larry from Hopkins describing all the things that he had done at Hopkins, working with Amit, doing a number of curricular activities. And then one of the coolest ideas I think that came out of this year's conference was during the crowdsourcing and during the small group activities, the students came up with a way that they thought they could reward or award faculty actually for reinforcing this. Because one of the barriers that came up was, even if we integrate this into our curriculum, once students get into the clerkships, how do we sort of manage up? How do we help lead from where we stand and ensure that these ideals are being reinforced? And so a way that they came up with doing this to influence that I thought was brilliant was our students designed these Choosing Wisely pins. The picture doesn't really do it justice, but it's this really nice looking pin that they created. It says Choosing Wisely. It's got our STARS logo there. And they have put in place a program this year at Dell Med where the students during their clerkship rotations, at the end of their clerkship, will nominate faculty who actually supported Choosing Wisely education during their clerkship. So folks who brought it up or who supported them using their SOAP VS, where they talk about value and safety as part of their oral presentations. Lots of different ways that they do this, but their class themselves, the students are going to nominate these folks. And at the end of the year, some of them will be awarded publicly and will be given these pins to hopefully, prominently display, which we think will help sort of send that message within the clinical learning environment. So we share with our STAR students a timeline about what to expect. And so it isn't just this leadership summit. That's really important. So the program is really a longitudinal learning collaborative. So we have the leadership summit in January. We then send the students back to begin working on their education ideas with their faculty mentor. We do regular check-ins, as I'll put on this in a second, but in July 2019, so at 6 months, we do a first progress survey where we really check in with the students and say, how's it going? What have you achieved over the first 6 months? And then they continue work over the year, and at the end of the year, we do a final formal progress survey. And we also survey and measure the attitudes of their fellow students. So even the students who did not participate in STARS, we measure their knowledge base and attitudes towards high-value care and choosing wisely. And then we stay in touch with them following that. We also host regular conference calls with the students throughout the year for them to share their experiences with each other and with us to discuss updates and challenges that they're coming across. And we similarly have 2 faculty conference calls over the course of the year where we check in with the STARS faculty, answer their questions, engage them kind of in helping us think about the program and how to improve it. Through the year, we also use the Slack platform where students share success stories, share resources, post things. You'll see, I think earlier I'd seen when we were preparing that Maggie from UVM, one of our star students who's been posting is part of this call today because of course she is, she's amazing. And so she shares some of her success stories and resources here. The students can ask questions on Slack. So over the very first year, and we're collecting the data obviously on the second year where we think we've even accelerated this, but during the first year we found that 60% of the participating schools had actually already achieved some level of curricular change. So whether that was introducing an elective or actually integrating this into their case-based learning, or you know, they essentially had achieved something that was within the formal curriculum. 55% of the schools had started some sort of Choosing Wisely related interest group. Almost half, 48%, had held a special event like EVMS did where they had a Choosing Wisely day. There were some that did a campaign over the course of a week. 12% had started a new Choosing Wisely or High Value Care Journal Club. I know I actually had participated via Skype in journal clubs with folks across the country. Some had pursued research. Over a third of the students actually presented directly to their deans or their curricular deans, which is pretty incredible, I think, when you think about that we had first-year medical students, but because of their position in STARS and because of the work they had done, they were able to make the case directly to their deans. And about a quarter during that very first year had already created enduring materials that could be shared. So these are good outcomes for any sort of medical educator, let alone first-year medical students. And this has really spread, as I've hinted at already. So we just published in Academic Medicine, and in fact, the proofs for this was ahead of print, but the print proofs are in my inbox, which is really exciting, that there's been a global groundswell of students leading Choosing Wisely initiatives. So from that first seed that was planted in Canada, there is now at least 7 other countries that have started STARS-like programs across the world. And in November, we are having a Choosing Wisely International Summit for medical educators for these countries and others who are looking to do this to really talk about how medical students can spread these initiatives within their own schools, which I think is quite exciting. And in that Academic Medicine article, we provide some of the sort of outcomes and data that we've seen so far. So if you're interested in learning more, interested in getting your school involved, we look to grow the program yet again this year. We have generous support from the ABM Foundation, once again, who's partnered with us on this initiative. And so here's the website where you can go, you can find out a little more information, and we have kind of an open application where a faculty mentor can go in and apply on behalf of their school and say that they're interested in doing this and interested in being the local champion. That URL is kind of challenging, so I went and checked today, and indeed if you Google Choosing Wisely STARS, it will be the first and second hit, so you'll get there. So just have to remember Google Choosing Wisely STARS and you can get to it. I also wanted to share with the students a number of tools that you and that the students can use to learn and teach high value care. And one is one that we spent a lot of time and money creating here at Dell Medical School, and that's called the Discovering Value-Based Healthcare, which are interactive learning modules that we've created. They are available completely free, so free access, and even provide free CME credit for practicing physicians. And they're focused at every level of health professional. So from medical students, nursing students, we have PAs, we have faculty, and everybody in between have used our modules, as I'm about to show. We have 10 different modules available, split into 4 sections. And each one takes about 45 minutes to an hour to complete, and each section provides you with a CME credit or a certificate of completion. And we think this really teaches the basic foundation of healthcare value and can be used in settings where you don't necessarily have the local faculty expertise or perhaps the dedicated time in the curriculum. So we've seen lots of different ways that this has been integrated throughout the country and in different settings and different programs. And we also share with the students that this is part that we've put those modules within a larger program, teaming up with the High Value Practice Academic Alliance, and once again with Costa Care, to create a program called MAVEN, Movement to Accelerate Value Education Nationally. And that program has sort of an outlined curriculum with a number of tools that medical educators and students themselves can use to learn the basic foundations of value-based healthcare. And so we point the students toward that, as well as toward other resources provided by HVPAA, where they can team up with the Future Leaders program there, where residents are involved in projects, and we try to connect those two groups of learners. And what I'm sharing now, I'm not sure if you can see my slide or not, but I'm sharing a slide that shows that the modules have now, we've had more than 200,000 page views and more than 10,000 unique users who've actually gone in and registered and used the site, and really favorable outcomes from those modules, which we just published in academic medicine as well this past year, open access, our results from the first year and a half or so of the program. And we have found that our students have once again been able to lead from where they stand. So our students at Dell Med, we were able to survey them, and in response to having done the modules, 96% of them say that because of doing that, they have discussed value-based healthcare with their peers during their clinical clerkships. And 98% said that during their clinical clerkships, they thought about how to make value-based changes to the healthcare system. We had a 90% response rate from our school. It was pretty amazing. Now, our students are very self-selected. They've come here to kind of do that. So I realize that this may not be exactly the same results everybody gets everywhere, but that is what we have found here. So I'm sharing now the reference and the site for the academic medicine article and for our modules, which are available for free.
Chris, this is Lisa. I'm sorry. Unfortunately, the slide did not advance anymore. I don't know if you want to try giving up control to Kelly Raymond, and she can try it from her end, or we can try to chat in some of the links, but I'm sorry that we're not seeing that.
Yeah, well, I apologize too. I'm not sure why it's advanced on my slides, but I'm towards the end now. So at this point, I think we just kind of just continue on, and I can share the links, and we can share the slides afterwards. Yeah. So I can tell you the website for the modules is VBHC, so that's value-based healthcare, so vbhc.delmed.utexas.edu. But it also is, if you were to Google Discovering Value-Based Healthcare, or just, Google Dell Med value modules, I'm sure that you will get it.
And Kelly just chatted it out to the group as well. So everyone could get, you guys could click on it and see it right here.
Great, thank you. And so, the last point that I want to bring up is that we are focused on medical education, but it is really important that we achieve alignment and that we bridge medical education to the health system. So Vinny Aurora and I published in Healthcare this last year this idea of achieving alignment in medical education, and I know many others have also published and discussed about bridging leadership, with the idea that we develop curricula to support alignment, and that's really what we've talked about so far today. But then in the health system, we also have to implement systems changes that reinforce that alignment. So value improvement projects, activities, things that, that show that what we teach in the classroom is what we actually are looking to practice. And then we believe that there has to be a role for a bridging leader that is on both sides of that, so that is aligning the educational and clinical priorities, goals, and opportunities. And there's been an emerging kind of group of bridging leaders with all different kinds of titles and specific job descriptions, but essentially this is what those of us hope to be doing, which is aligning those priorities. And so our goal for the future for STARS, which is where I'll end, is to continue to grow the STARS program for our medical students, but to create a synergistic program that we're calling STARS Unite for value. And Unite is a bit of a wonky acronym, but stands for Utilizing Nursing and Interprofessional Teamwork Expertise. If any of you have ever worked with Vinny Aurora, you know that that is a brilliant Vinny show of her genius. She can make anything into an acronym. And so the idea is to have residents, nurses, interprofessionals, pharmacists, social workers, case managers, PAs, even, administration, working together to create value improvement activities within the clinical learning environment. So we envision that we will, similar to the STARS program, recruit teams to come participate in a summit, which we will partner with the HBPAA to have during their national conference. Bring these teams there. The teams will have to be, we're aiming for about 15 teams of 3 to 5 interprofessionals each. Must include a trainee, so whether that's a resident or a fellow, could even be like a nursing student, and at least 2 professions within the team. Similarly, teach them about choosing wisely, value. Really also, if we're looking at delivery, thinking about equity and how we close the gaps of disparities. And so thinking about how we have some good ideas, I believe, on how we're going to do that. And then creating a learning community for them to go out and do these projects in their own clinical learning environments, and to team up with the STAR students at their schools, so that they are pairing what's being taught in the classroom with what's being delivered in the clinical learning environment. So we believe having these two kind of parallel but intersecting programs will work to kind of help ensure that this program creates real change and not just educational curricula, which I think are critical, but we need to do more. So I'm actually going to close, and then we'll have plenty of time for some questions and answers, and we can share links or do whatever is most useful here. But I have a quote here that I actually had seen in a coffee shop in San Francisco about, I don't know, somewhere between 5 and 10 years ago, that I think really summarizes our approach here. And the quote is, "If you want to build a ship, don't drum up people to collect wood, and don't assign them tasks and work, but rather teach them to long for the endless immensity of the sea." And I love that for lots of reasons, but I think it's because what we really are doing is, instead of saying, being a regulatory body or someone else saying, this is what you have to do, what we do is we bring in these students, and hopefully in the future these interprofessional teams, and we simply show them a better way. We show them how good this care delivery can be, and what the vision for value-based healthcare looks like, and how others have been able to implement this into their programs. And then we are flexible enough to support them to innovate within their own environments. So oftentimes I'll be asked, like, what is the faculty will reach out and say, well, what's the deliverable for my student? And we say, there isn't really a strict deliverable. We just hope they're inspired to go do something, and that you're going to figure out what is the best thing for them to do within their environment to reach towards our goal of integrating, choosing wisely, and value-based healthcare into their education. And, we're going to check in at 6 months and a year and basically ask you what you did. And we, like I said, have found that they come up with things that are so much more innovative than we would. And, here at Dell Med, we've already got a whole bunch of value-based healthcare curriculum. So they came up with the pins, whereas somewhere else, they might not have anything, and so creating a curriculum. And so really, we just, I think, lay out the vision for them, provide them with the support, and let them learn from each other. And we have found that this is a model that is not only working here in the U.S., but really has spread without much, just kind of on its own, which is incredible. Which is also not to downplay the amount of work that Karen and Brian have done in Canada to help that spread. But so with that, I want to thank the ABAN Foundation for partnering on this project with us and on this program, and helping us grow and giving us the platform today to share it, as well as the Macy Foundation, who has similarly provided President's Grants and have funded this program to date. And I sincerely apologize for the technical difficulties. I'm not sure why my slides are advancing but not showing up. So we will figure out a way to share that with you. But thank you for those of you that stuck with it despite that. And I am happy to open this up and answer any of your questions.
Great. Well, thank you so much, Chris. And sorry again for the technical glitches. I was saying we definitely have some gremlins in the little web platform today, so sorry, everyone. But we will certainly share your slides after the webinar with everyone. And we appreciate the stories, which are, of course, the most important thing. So let me just open it up. Anyone can unmute themselves, just mouse over. And feel free to jump in with questions, or you can also use the chat function and just hit chat to all. Well, I will jump in while we wait. And again, anyone can unmute or chat a question. I don't know, Kelly, I'm not seeing any chatted. Oh, maybe not. I'm not seeing any chatted questions, so let me know if you are seeing any. But I'm wondering in terms of, just the whole culture change, and I love your quote, and I'm going to definitely look that one up and steal it, I think. Absolutely love it. But, you mentioned that students come to Dell because, it is what it is, and it's a different kind of school and has this value focus. What's your experience been, or what's your maybe, perception of how this would go at other medical schools that aren't Dell?
Yeah, that's a great question. I have to say the students have really picked this up everywhere. And I've talked to Brian Wong about this, who's had experience really trying to integrate quality improvement into education, has had a lot of success in that. But we've talked about how it sometimes can be a hard sell. And for whatever reason, I think there's lots of reasons that we can come up with together, but the message of choosing wisely really resonates. And so the students themselves seem to really pick it up and run with it without much needing to, kind of prod them along or convince them. Convincing faculty members, once again, we do have a self-selected group within STARS in that the schools, they've already had a faculty member who has kind of nominated their school to participate. And so in general, they've been fairly open to implementing activities. I think we have found that the response has been quite positive. Now, I've heard when it comes to formal curricula, that can be a challenge. So I've actually, gone and given grand rounds at amazing academic institutions that have incredible leaders in health system science and value-based healthcare, and they will tell me, oh yeah, my class is one of the least favorite classes, or the students really don't love this class because they say that it's not on step one, which always shocks me because I'm like, man, you've got incredible talent and faculty here. So I think when it comes to formal curricula, it can be more challenging, and that's where I am in a bit of a special situation being here in Austin at Dell Med, where the students tend to embrace it. But as far as the type of, especially informal things that in general our students are promoting, it seems to really go over well at the schools. And we haven't found a place that has been, so resistant, or actually out of the 40 schools so far, we haven't found a place where they haven't been able to implement some activities around choosing wisely.
Great. And again, just an open invite to anyone to either chat or unmute yourself for questions. So I will keep going because I have lots of questions. So knowing kids today, young people today, and their emergence as digital natives, I'm wondering what you're seeing in terms of social media and ideas they've had or use of social media related to choosing wisely. Has that been part of the discussion or initiatives at all?
Yeah, it's interesting. I will have to say this is one area that we've been somewhat disappointed. Disappointed might be too strong of a word, but we had expected or hoped that the students really would take off. And the first group in Canada had started their own Facebook page that was, on their own and really shared things and had used it. The first cohort from the U.S. had started to, had kind of done the same when they heard that story, but really didn't use it much. So we had tried Facebook, we had tried you know, getting people to use Twitter. There's only a few folks from our cohort who's used Twitter. And so, you know, we've been using Slack, but even that hasn't had as much engagement. I think there is a bit of actually there's like a bit of a generational divide here. The students are not, you know, they're on Facebook because they kind of like have to be, is what I hear. It's more like a family thing, but they don't like using it as a social channel as much. There are not very many of the students, you know, they're mostly apparently on like Instagram or Snapchat, and that hasn't happened as organically as we had hoped. Now, when they have an event, oftentimes somebody or their faculty members, like we see stuff on social media that helps push out the message, and we try to do that as well. But we had hoped or envisioned that the students themselves would have kind of taken up social media more than and helped spread that more than they actually have.
Interesting. Huh.
Yeah.
I guess it's kind of hard to share in Snapchat or Instagram.
Yeah, or, you know, or we're just not even seeing it. Maybe I'm just not even seeing it. Which I will say in Japan, they use a version of like WhatsApp, and that's like how the whole program is run. Like there's a medical student. So in Japan, there's a medical student who essentially started this whole thing. And he like organizes it basically himself, which is crazy. And he uses like WhatsApp, and all that happens kind of outside of the view of faculty. And I know in Canada that there was also some use, I think, of like WhatsApp that there was. So there are probably organic conversations that appropriately happen amongst the students themselves and sort of outside of our view, and that's cool. So I don't know how much of that's happening. I do wonder, so I see Maggie, as I had mentioned, on the line, and she, as I mentioned, is one of our STAR students this year from UVM. And Maggie, would you be willing to jump in here if you're on the phone and just kind of share your perspective and experience?
Sure, absolutely. Well, I have had an amazing experience in STARS, and I'm so grateful that I've gotten to be a part of the program. At the University of Vermont, we really did not have any kind of formal curriculum surrounding high-value care. It was mentioned sort of passing a couple of times, you know, should we order an MRI or is an X-ray enough? But what I've been able to do that I'm working on right now actually is integrating the Choosing Wisely recommendations that correspond to content that we're learning in class. So that it doesn't feel like sort of an extra burden for students or faculty. So we have our cardiovascular, respiratory, and renal pathophysiology section coming up next. And I've actually sort of, with the course director, mapped out all of the recommendations that correspond to what we're going to be talking about. And I'm working with faculty directly to get that integrated. So we've had to be a little bit creative. I think one of the biggest barriers I've run into is that, sort of like you mentioned, this content isn't necessarily on step one. So a lot of sort of the control of curriculum, I think, tends to be built around preparing us for that exam, which is totally understandable. But that said, it makes it a little tricky to get through, you know, formal curriculum committees and boards. But sort of finding ways where we can put it in. We have also something running in our student newsletter that they send out every week. A Choosing Wisely recommendation of the week. If you read it and answer a question, you get entered into a prize raffle. So we've actually had a really good response from students for that as well. So I think it's been about sort of finding the little ways to integrate it, but it's definitely doable. And I think that working with other students as part of the STARS program, meeting, talking, using the Slack channel to sort of bounce ideas off of each other has been really valuable.
That's great. Thanks so much for joining us.
Absolutely.
Thank you, Maggie. That was awesome. We
also have a question for either one of you, or both potentially. So from Deb Cook Altroni, have any students focused on patients with high deductible health plans who are motivated to control costs?
Yeah, that's an interesting question. Once again, I'll remind you that the students that are generally tackling this are first-year students. Now, they're starting to mature because we're in our second year, so we do have second-year students. And so that is to say that they have mostly focused, really, as I mentioned, on curricular change rather than actual, like, implementation or improvement activities. Focusing specifically on patients that have a high deductible plan would be like a perfect type of project for our STARS Unite program that we hope to launch, right? Like you could imagine an interprofessional team that tries to do that. I will say on an educational side, that was part of our summit. So part of Ari Hoffman's talk was really around kind of the affordability issue as part of the, value discussion. And we at Cost of Care certainly think that is, that's kind of the area that we focus on is affordability and, the fact that more Americans than ever before are on high deductible health plans and how that affects their decision making and so on. So we certainly have that be part of the discussion and part of the teaching. I don't believe any of the students have particularly done a specific project or even created a specific curriculum around that. As I'm thinking out loud, I will say that some, like the Dell Med students last year, implemented some of the principles into our case-based learning, and at least one of the examples did include that in the prompt, right? Like they basically talked about the patient's high deductible plan and how that would affect decision making. So I guess in that way they have implemented it as part of what they're doing.
Great. How about just anything else that you think has been a particularly innovative approach that, you feel like is coming from young folks in maybe a different way than we would young folks as well?
Yeah, I have just a couple examples. I mean, so last year, I off the cuff, I'm trying to remember if this was the students from UW or the students from OHSU. So I apologize to whichever it was, but somewhere from the Pacific Northwest, the students had looked at wanting to create a podcast with medical students, very brief, like what's important to a medical student about this that they then could share openly. I think they're still working on really making that a reality, but that's an interesting idea would be like a medical student led, very brief snippet, like here's why this matters. But another way that students had used media, so the students in the first cohort at Mayo, which ties together a little bit that first question, they said that they did find a little resistance on why this was important. So we discussed that some students, not the STAR students, but other students may feel like, well, this isn't part of step one, is this actually relevant? And so they wanted to make the case that it was. And what they did that I thought was quite innovative was they went to the students who were in their clerkships, so the third-year students, I believe it was, and they created a short video where they basically interviewed those students about like how do these issues play out in the clinical setting, like what are you seeing as a student? And sometimes we forget that when students first hit the clinical environment, some of these things that we take totally for granted, they find shocking, right? Like things that are shocking and that we should continue to find shocking, we're a little bit immune to, but they get in and they're like, oh my God, I can't believe that it works this way. I can't believe that we just, order a head CT on every patient, so on and so forth. And so they had these students kind of share why it was important and what they wish they had known. And they created this brief video, and they showed that video during like orientation to the first years the following year. And I thought that was really cool, right? Because now, and once again, it's not me or somebody who they're like, yeah, okay, whatever, this is important. It was like their colleagues saying, this really is relevant, and we wish we kind of had a way of thinking about this before we got into our clerkships. So I thought that was really cool, and they were able to do that, I believe it was at Mayo.
Great. Others? Anyone else? Question, comment? I just think it's incredibly exciting, and the whole notion of starting upstream, working with learners and residents, I just think is a fantastic way to really change the culture. So,
thank you, and just wait until you get to see my amazing stream slides and all the incredible graphics that I have to go along with this. So, more to come.
Yes. All right. Well, again, we apologize for that, and sorry everyone on the phone, but you will see those. We will get those to you. So anything else before, Kelly, I turn it back to you? All right.
Oh, thank you. I appreciate the opportunity to share this example with you all on the call and with those of you that are watching this after the fact.
All right. Well, with that, we will probably wrap. I'm not sure, Kelly, if you're coming back on, or I am probably just closing it right here. So thank you again, Chris, and all of your learners and colleagues who have contributed to this emerging body of work. You're clearly setting a great example for all of us, and we old folk can certainly stand to learn from you. So thank you so much. We look forward to hearing more about your work as you go.
Thank you. Appreciate it.
Okay. Thanks, everyone. We'll see you next month. Bye-bye.
Kelly, I'm sorry. I don't know what happened. It was sitting there. It was totally advancing on my screen.
Hi, Chris. This is Kate. Kelly actually left, but it's okay. It happens. Could you give me the controls back? Could you put it back on Kelly's name, and that way I can